So as far as cleaning and everything else like that goes, do you guys have preference? What would you advise a patient? Do you like an electronic toothbrush? Do you like a handheld toothbrush? Do you prefer a water pick over super floss?
I'll start. You can finish it. So for teeth themselves, just as an FYI, electric always trumps mechanical. For a hybrid, I'm kind of indifferent to mechanical versus electric as long as it's effective. The reason why is when you're brushing teeth, you're actually brushing, we'll go back to the cuticle example, you're actually brushing that cuticle to keep it clean. The connection between your hard tissue, which is your nail, and your soft tissue, which is your cuticle. And so that is important that it gets thoroughly brushed and taken care of and mechanically debrided. When you're using a toothbrush in the mouth for a hybrid patient, you're more or less surface cleaning that so it doesn't really become stained. You're kind of helping disinfect the area. You're not doing anything to help rebuild or reconnect any of that soft tissue to hard tissue. And in general, the soft bristles, even if it's a super soft bristle or whatever toothbrush you're going to use, is really hard to get to where the implants are located. And so for me, I don't make a big delineation versus electric versus manual, except for if a patient wants to ask, I'm going to recommend electric over, but a mechanical is totally fine. If a patient goes on a vacation to Europe for 2 weeks and they end up using a manual toothbrush, it's not going to put anything at compromise. The one thing that you can have an issue with is long term, this surface is like glass. The zirconia, we'll say, is like glass. You can scratch it if you use, say, a wire brush, use a hard toothbrush. You can scratch it and cause an area that will be more prone to staining. So it's important that you still use a softer toothbrush, but it's not in terribly or as terribly important as it is for brushing regular teeth, electric versus manual, as it is for a hybrid.
So with that being said too, do you also have a preference on toothpaste? Because during the consultation, we do sometimes speak about the abrasiveness, kind of test the toothpaste between your finger test, see, if you feel any little grit, try to stay away. Is that the same kind of example?
Yeah, I would say, on teeth, toothpaste is actually, meant to promote remineralization of teeth and has fluoride components. Really, for full arch, none of that exists. So I would say if you want to use toothpaste to have that fresh, minty feel and to have something that, tastes like you're brushing your teeth, a very, very small amount is okay. But you don't want to be grinding it very hard, because the reality is any toothpaste can be abrasive, whereas the brush isn't. So I think the key there is just, like Dan said, keeping everything clean, avoiding staining. And for me, I think the number one is using any type of water irrigator to clean the intaglio, which is the undersurface of the teeth to the gum tissue. And
we used to talk a lot about abrasiveness, so I'm glad you brought that up, because I've kind of gotten away from it. The surface of the zirconia is such that abrasiveness really isn't going to come into play, but there are toothpastes that are unnecessarily abrasive. When you get a whitening toothpaste, as a general rule, when you get a whitening toothpaste, what they've done is taken their toothpaste formula and they've essentially added different particles of sand. And that pumice that's in there is abrasive enough to take the surface stain off of your teeth. Well, in zirconia, we're not going to have that issue. So getting anything that's 3D white, super oxide white, etc., is going to have that pumice. It's going to cause more abrasiveness for absolutely no reason. So to Blake's point, you want to select, if you're in the toothpaste aisle selecting, you want something, as a general rule, being more of a sensitivity toothpaste. A sensitivity toothpaste isn't going to necessarily have that abrasiveness to it. So in an ideal, perfect world, we don't need that abrasiveness to make it white. You already chose your color. You just need to keep it from being stained. And so we want to use something that's really slimy in the hand. So if you were to test two different peas of toothpaste in your fingers, and you would be able to feel one is going to be more abrasive than the other.
Right.
We would ideally want you to use something that's more slimy, because the practice of using a toothbrush is just to kind of disinfect and clean the mouth, but it's not to scrub really anything off of the surface in a hardcore way. We want to just keep it clean. You're not adding any sort of abrasiveness to make it more white. It's already that white. You just need to keep it clean.
Mm-hmm. Is there anything that patients can potentially put inside of their water pick tank to help with any of the underneath kind of buildup? Anything that helps on that end? Some patients like to put some peroxide. I've also heard some like non-alcoholic mouth rinse. What is your perspective on that?
So as it comes to water picks and Superfloss, to touch on the Superfloss thing, Superfloss works fine, and it's a great way to get underneath any sort of bridge. If you have a regular bridge, it's a great way to get underneath it. Great way to get it sort of mechanically debrided, get the stuff away that's loose and kind of in the way. It certainly is an effective way to loosen things in a hybrid. I don't necessarily push Superfloss as a daily because at some level it's going to become so inconvenient that the person's going to give up more than we want them to give up in terms of cleaning.
That's what I was going to ask if you had a preference on, because some patients do say it's kind of just, it's one other extra step that you have to do that they probably did not do at all before the procedure. It can tend to be kind of a pain because you do sometimes the prosthesis is really tight, so it is difficult to kind of get that Superfloss through it. So I know we typically don't touch on it too much in our office. We do like it. It's not that we don't, but we, I think, prefer water picking, right?
Yeah, if I'm asked and obviously that's the point of this conversation, but if I'm asked what the absolute preference is, sure, use it, but it's not something that I'm going to push on you to add to your routine, because I don't want to push anything that's going to encumber you and cause you to do something else that I consider to be of more value less often or less thoroughly. So that's kind of how I see Superfloss is. Use it for big stuff. Maybe have it on hand. Try it. If you want to include that in your daily routine, that's totally fine. I would certainly not dissuade it. But some people are going to have some tough spots. It might be a little bit touchy to do it. It might be even difficult dexterity-wise to get it done.
Yeah. So
it's not anything that I really, really heavily push on patients. But then as a substitute, we will use water pick. And a water pick is really in my opinion, your number one go-to tool to keep things clean. Why? Because it's going to be able to irrigate and get into places that you can't get to. And you want to prevent, we call it biofilm, when you want to prevent bacteria and food from collecting on the underside of this area that you can't really brush and get into. And so water pick is going to gently irrigate and rid yourself of all of that stuff. Is there something that goes into a water pick? Not necessarily, other than the recommendation is add whatever you would like. You could add a mouth rinse into it. You can add salt water into it if you're feeling like your gums are sort of irritated and swollen. You can add as an additional step anything that you want into the reservoir. And while I'm on the topic of reservoirs and water picks, I like my patients to always be on a sort of desktop version, if you will, of the water pick.
Yes.
Or something that is in line with the shower, because you're going to get the volume of water, the volume of lavage, if you will, through that space versus the more portable ones. I don't really like those. I know it's a big popular thing with Facebook because you can take it with you, etc. I'm okay with that as an add-on as well. But I don't want that to be the number one quarterback of what you're using to keep that irrigated, because it's smaller amounts of water, it's smaller bursts, it's not as strong. And you can use it when you travel. That's fine, that's great. But I don't want that to be the number one water pick. That's always your convertible, if you will. I want your daily driver to be something that sits on the desktop that has a relatively big reservoir that has the difference in pressure that you can change, etc. Versus being relied on like short little bursts that may not get to where we want. And we're not pressure washing with a water pick. We're not cleaning the side of a house, like I always say. We're just irrigating it. You're just trying to flush that area of soft particles. When it gets to a point that you've left it long enough that it becomes hard, that's where the maintenance comes in. That's where we have to come in and get that off and fix you as a habit person, as fix your habit and make it so that you're getting it better. We want to be able to attack this when it's still soft and when it's still there. So daily cleaning with a water pick is very important.